In Europe, 50% of the population suffer from periodontitis. It is one of the most prevalent chronic diseases in the world, which deteriorates the quality of life and represents an enormous cost burden on global healthcare systems. What if dentists had the right tool to integrate bacterial diagnostics and monitoring to the general checkup appointment? Regular diagnostics could make it possible to avoid the development of infections and prevent periodontitis, a silent epidemic. To address this health issue, the European Commission funded the DIAGORAS Project. This project gathers 10 partners from 8 European countries, received a grant of 5.6 million euros, started in June 2015 and will last 4 years. It aims at developing a chairside diagnostic device for oral infections. The DIAGORAS Project will help reduce the burden on global healthcare systems and improve quality of life worldwide. To understand how DIAGORAS can help the dentistry practitioners, we invited Dr. Pune Nina Tabakoli, specialist in caries and periodontitis, to give her opinion on this innovative tool. There was a lot of innovations in oral health. However, there is still no solution to prevent oral infections. Why?
We gained a lot of knowledge through dental research. However, there is still no solution to prevent oral infections. These are, for example, caries and periodontitis, which are the most prevalent ones. And it is well known that both have multifactorial causes. For caries, for example, it is not only the bacteria, it is also the host, the substrate, like the nutrition or sugars, and it is the time. But there are also more individual factors, such as the patient's behavior, their attitude, or their knowledge about oral health. In periodontitis, it is also not only the bacteria, but it is also the host response or the inflammation. And what we need is a tool to detect these infections at an early stage or try to prevent them.
How do you diagnose periodontitis in caries, and how long does it take to get the results of analysis?
The basis of dental diagnosis is in most cases still the same. We depend on the clinical examination, the medical history taking and X-rays. There are only a few microbial tests available, and these depend on biomarkers or bacterial detection in saliva or deep tooth pockets. However, the analysis of these tests have to be performed in external laboratories, and the time to result usually takes 3 to 5 days. It is quite time-consuming.
Do you have any tool in your dental practice to identify the cause of these infections?
To identify the cause of these infections, we still depend on the intense medical history taking, and we need to understand the knowledge of patients on their oral health and their behavior. The few microbial tests available are limited to the bacterial analysis or the inflammation only. And this is, as said before, quite time-consuming.
If you had a device like the one developed by the DIAGORAS Project, what could you do for your patients in your dental practice?
The DIAGORAS device could speeden up the time to results close to 1 hour, so we could use it as a chairside device. It could provide us with information about biomarkers or bacteria in the saliva of the patients, and we could use it as a tool to monitor the infections of patients over a time. It could also help us to make a prognosis for patients who suffer from oral infections.
You are a member of the DIAGORAS Consortium. Can you tell us more about your role in the DIAGORAS project?
We are very pleased to be part of this innovative team and project. The University of Zurich and Karolinska Institute helped to develop the oral part by testing biomarkers and bacteria in natural saliva samples. We will also compare the DIAGORAS device against the gold standard methods used in laboratories. This will be performed in a clinical study.
You're involved in the clinical trials for the DIAGORAS project. How many participants do you have, and can you tell us more about the process?
The clinical trial will involve approximately 250 patients, which will be grouped in caries, periodontitis or healthy patients. After clinical examination and grouping, they will donate their saliva, which will be analyzed with the DIAGORAS device or the gold standard methods in laboratories.
The DIAGORAS project aims at developing a device and a lab on a disc, the oral disc, which will be able to detect the main pathogens involved in oral infections. The analysis is molecular-based and will therefore allow a semi-quantitative measurement of bacterial oral pathogen populations and would also include a biomarker response. During the checkup appointment, to measure the risks of infection of the patient, the dentist will use a device developed by DIAGORAS. To ease the work done by the dentist, the samples are analyzed at the point of care. The oral disc can diagnose periodontitis in caries with the measurement of the bacterial DNA by PCR. The results will start being obtained within an hour after the analysis starts, speeding up the actual process of diagnostic. The platform will allow the timely, on-site and evidence-based prescription of personalized treatment procedures. The era of late and empirical diagnostics of oral infections should be left behind us. The DIAGORAS project partners are hoping to bring the world a tool that will stop the spread of the silent epidemic of oral infections. To follow the progress and results of the DIAGORAS project, please visit our website at www.diagoras.eu.